So this is the low back and belly roll. And so what we're gonna do is have Tam swing her legs around to the left and glue that roller up to her right hip. Yeah, it stays really glued. Keep it glued and drape yourself over the roller, setting your right elbow on the ground. Yeah. Now step your top leg forward and straighten out your bottom leg. That is an option. Straightening out the bottom leg gives more space in the waistline. And if somebody is having a hard time, like even finding that space as it is, bending the bottom knee will help them nestle the roller in a little bit deeper into the waistline. Gentlemen tend to have less space in between their rib cage and their pelvis. So sometimes they have a hard time finding this place. That's where we grab the blue ball for them. And on that note, you are always doing this, no exceptions, with a blue soft roller. So as a public service announcement in the beginning of class, when you're doing this, you'll say, please do not do this at home with a firm roller. That is not safe. Okay, so here we go. We're gonna take a big inhale and exhale, let the waistline drip into the roller and start to rotate onto your front side, letting the right side of your belly connect to the roller. Now Tam's just gonna stay here. We'll often rock back and forth between the two to get people to know the space where there are no bones here. That's something you're saying. You want the roller to be above your pelvis and below your ribs in the place where there's no bones. So roll into your belly, and if you want to stay, drop your left knee into the ground and bring both forearms into the floor. This is an abdominal roll and a visceral roll. So if people are feeling any kind of strange, sharp pains, that is all really normal. It's a gastrointestinal area. You just want to try to get them to be comfortable with that sensation. Anybody who's pregnant, even just a little bit, they are not doing this roll. They don't want to disrupt the activity in the belly. We're taking a big breath in, inflating the belly into the pressure, and exhaling, letting the belly soften and the pressure melt in. And probably stay here for 2 or 3 breaths, just because it's really unfamiliar to people and you're trying to get them to soak the roller in. And then when ready, roll back onto your side. You can do this in 2 different ways in the back line. The safest way is what Tam just did, which is stepping her left foot behind her and then rolling into your low back, staying at about a 45-degree angle. There's another way to do this, which is keeping the left foot crossed over the right foot and coming open into a spinal rotation. Yeah, or just like for a brief moment, opening out. Yeah, staying on the elbow. Yeah, exactly. Yes. Tam's got it. She's got you covered. Yeah. So you make a choice. With the foot crossed in front, it's not a sustainable move. So when you're ready to nestle into the lower back, you'll bring that left foot back behind you. Find an angle there on the back line of the body. This is the QL muscle, right in between the hip and the low back. And you can rock side to side or just simply stay on it and breathe into your low back, inflating the back against the roller. Exhaling to melt in. You might start to roll down and up, lengthening the tissue alongside the spine. This is a contraindicative move if somebody has really inflamed discs, if they're really acutely inflamed in their low back. But if they're not and they want to take this deeper, they might take their elbow into the ground, head in their hand, or drape all the way up and over to the floor. That can feel like a lot of pressure for somebody. So maybe give them the option and then just let them know. If this feels like too much, come back onto your elbow. That's the low back, belly, waistline roll.